Community pharmacists are a useful tool to help bridge the gap in unreported cases of sexual and domestic violence in Lagos. This formed part of the rationale for a DSVRT training at making community pharmacies a safe space for survivors. Kemi Folademo has more.
The Lagos State Domestic and Sexual Violence Response Team says that between January to June 2021, at least 60% of survivors of domestic violence sought help at community pharmacies, out of which 50% didn't report at the designated police station or go to the hospital. The DSVRT is now capitalizing on this window to introduce and implement its Speak to Inward scheme that will enable victims of abuse to access critical services from the comfort of their local pharmacies. To achieve this, the team trained 95 licensed pharmacists with the aim of creating safe spaces needed to combat the twin evils.
But there might be other people in the pharmacy when they come. And these people are in the same community, so they may not want another person to know that this is what I'm reporting. So it's either they make use of the word orally, the code scheme orally, or they tick on the prescription sheet that they would like to speak to and then the person is taken into the counseling room in a confidential manner, and then the case begins from there.
You're in an abusive situation, and there are places where you can report it that does not have to end up at the police station or going to court or looking at issues of jail or prison, but that sometimes just to help you to process the trauma and get support in that wise. The pharmacists can help with that, especially community pharmacists.
The Pharmaceutical Society of Nigeria welcomes the board partnership with its members who render essential services. The sessions covered teachings on understanding gender roles, gender-based violence, raising the index of suspicion, as well as application of the laws and existing state structures.
Then the person that has actually perpetrated this crime can go behind bars, can be locked up for years. So when they know the law, they'll be able to sensitize the public as well. They'll be able to sensitize the victim that comes to them. They will know what kind of advice that they will give that victim.
I will praise the organizers for discovering that there are a lot of cases that have been lost by not focusing on what happens in the community at the community pharmacy level.
If you have someone that walks in all the time to request for painkillers or comes in to request for eye drops for black eye, red eye, your suspicion goes up. So at least you take the step of asking for that question, and then we know the right questions to ask. We know the right place to channel the questions and how to help the victims get help.
With this initiative, once a survivor presents herself at the pharmacy, the referral pathway is activated for the pharmacist to refer her to the DSVRT or a designated health facility. Kemi Folademo, TVC News, Lagos.